Back to Practice has been made possible with support from Allergan and Novartis. We'd like to thank our sponsors for their support of this programming.
Welcome back to episode 5 of New Retina Radio Back to Practice. And today we are going to be covering combating patient misinformation regarding COVID-19, how it impacts our retina patients, how it impacts society as a whole. And I'm fortunately joined today by 2 excellent guests. We have Patricio Schlottmann, who is the Director of Clinical Research of the Medical Research Organization in Ophthalmology at the University of Buenos Aires in Argentina. And we have Nicole Eter, who is the Professor and Chair of Ophthalmology at the University Hospital in Munster, Germany. I'm John Kitchens with Retina Associates of Kentucky, bringing you this episode on September 25th, 2020. Just to highlight a few, unfortunately, grim milestones. Worldwide, we have 32 million cases of COVID-19, with nearing 1 million deaths globally. In Argentina, there are 678,000 cases of COVID-19 with 15,000 deaths. In Germany, there are 281,000 cases of COVID-19 with less than 10,000 deaths. And unfortunately, here in the United States, we have 7 million cases of COVID-19, and we've just passed 200,000 deaths. So with that, I'd like to get to my guests, and we will start with Patricio. Patricio, how are things in Argentina from a COVID-19 standpoint?
Hi, John. How are you doing? The situation here is the following. We're still in lockdown. So for many patients, there's still this restriction of movement. We have to issue them a note so they can come to the clinic. So they specifically need these sort of permit to be out in the streets. The numbers, we have never had a peak. If you look at the curves of cases and deaths, they went straight up and then they stayed up for a while, and it's only now that they started dropping a little bit. But we're still getting like 10,000 cases every day. And now we're getting about 250 deaths, maybe 300 deaths every day. It's sloping down, but it's sloping down very quietly, but still in a slightly relaxed lockdown. Some things are reopening, but still you need a permit to be on the street.
And is mask wear in Argentina pretty uniform, Patricio, or are people not wearing masks?
No, we didn't have any issues with people wearing masks. There's a lot of people where everybody wears a mask. It's very rare to see somebody without a mask. I mean, you may see the odd person not wearing it properly, but most of the time this is because of lack of information how to use it, keeping the nose outside, or maybe they're smoking or eating and they just bring it down a little bit. But otherwise it's fine. We didn't have any issues with groups promoting the, not using the mask. So that has not been an issue, and that probably helped, keeping the numbers, not too high. We didn't have a peak, as I said before.
And I noticed that Buenos Aires actually, for a major urban city, really has not had the majority of these cases at this point. It seems like it's more in the rural areas of Argentina, or it's about 50-50. What's your comments on that?
I think it's moving. I mean, at the beginning, the rest of the country was like a safe ground. There were no cases around, only in the big cities. Now we can see the big cities, and Buenos Aires, as you said before, maybe compared to the US, it's not that big, but the population of the city is 3 to 4 million. But if you include the suburbs, the suburban area around it, it can go up to 15 million people. So 90% of the cases were there. Now we can see the numbers going down from that point of view in the city and surrounding areas, and the rest of the country started peaking. So I think that over time we will see a coming down of the numbers of cases and deaths within the city and surrounding area, and the rest of the country start, flagging areas or other cities, with cases. But these are smaller cities, so I guess it's going to be easier, or slightly easier, to control this change in the area of COVID.
And what about you from an ophthalmology standpoint? Your department, is it back up and functioning normally now?
No, we're working at maybe 50% of the numbers of the patients that we used to see. Several patients delaying the injections, the operations, some of them not coming to the clinics, to the consultation, to the normal consultation. So maybe at 50% of power we are working at the moment.
And is that because of social distancing? Is it because of patients not wanting to come in? Is it because of government restrictions? What has you at that reduced rate?
It's a mix of both. We try to prioritize those patients. You know, if you call for that you need new spectacles, probably we're going to delay your consultation. But otherwise, if you're a patient that is in need of an injection, or you have had symptoms, you know, that may point towards having a retinal detachment or a vitreous hemorrhage, of course, you're going to be called in. There's a lot of paperwork to be done. So we need to kind of write a letter, which would be something that you have to carry with you if you get stopped coming to the clinic. We need to make sure patients come without the use of public transport, because it is only restricted for certain personnel that can use public transport. So they must be drove into the city. So that makes a little bit of a complication for patients. It's not easy for them to come, and it's not easy for us to keep the no waiting area. We need to be very sharp with the timing. So what we're doing is, have a no waiting area. The positive thing is that the weather is changing now. We're getting into spring here in the Southern Hemisphere. So the weather is getting warmer. So we can use our, outside areas, which before it was just a decoration part of the office. And now we're putting chairs so we can have our patients waiting in the open air. So they feel more secure. They feel more secure if they're waiting in the open air rather than being in a room. But we never keep more than 2 or 3 patients in a waiting area.
And surgically, are you able to do some of these semi-elective cases like epiretinal membranes, macular holes, or are those being deferred?
No. Surgically, we can do whatever we need to. Yes. The issue is more with the patients coming. As we're going to be discussing further, it's, a lot of patients, they may believe that there's something in the air, because they've heard it somewhere. The virus could be just outside in the air. So even if they come with a taxi to the office, they may just get infected because of, breathing through the window of the car. So that is the highest restriction. It's not within we authorize to do whatever surgeries we need to do and see whatever patients we need to do. I mean, it's all, the government leaves that decision to us. So we can issue a permit to each of the patients. It's a lot of paperwork and takes a lot of time, but the restriction is more on the patient side of, not wanting to come to the clinic, and a little bit on the paperwork side of things that we need to do to see a patient.
Nicole, turning to you in Germany. Germany has done an impressive job of managing COVID compared to other EU countries. How are things in Germany, and what's been the key to your success?
Well, we had a general lockdown starting end of March until end of April. We saw what happened in Italy and Spain. I think the COVID problem was earlier in these countries, and so with that lockdown, we had enough free spaces for emergency cases, for intensive care patients, and the units in the intensive care unit were expanded so that we could cope with the patients. And so we did not have this increase in numbers as other European countries had. And starting May until July, I would say, the numbers of COVID infections were really very, very low. And they are starting to climb now again a little bit due to the vacation. So the lockdown was over, and then all the restrictions were finally eased, and so people were allowed to fly or drive on vacation, and that was when the numbers were increasing again.
And I know there's questions all the time here in the States about the validity of a lockdown versus the economic damage. And as I understand it, Germany is having those discussions now. Like, have you felt that there's been a lot of economic damage from having such a strict lockdown, and has it become a problem months later?
Oh, yes, it has. I mean, during that lockdown, basically, I mean, you could go out, you could go to the supermarket, but other than this, everything was closed. All the restaurants were closed, and so especially little shops, also restaurants are really now battling, and some already have closed the doors forever.
Do you think people will be amenable to a second lockdown if it's needed, or do you think there will be major political fighting if there is that suggestion?
Well, it's not only the fighting, but it's also very, very critical, and I think the politicians realize this. And right now it looks that it will not be a general lockdown again, but there are some hotspots. And so there is a discussion whether then for a county maybe, or maybe just a city, there will be other regulations than for the whole Germany. And this has basically also been in the discussion, because we are a federal country, so there are different laws within the federal states.
You know, I think in the United States, that's probably the one big misstep we had early on, is when New York got hit very early and very severely, and the rest of the country locked down. And who knows what would have happened if we didn't do that, but it seems like many of the worsening cases occurred months later after the lockdown was lifted, and that perhaps we didn't need to shut down the entire country. We could shut down region by region. And I think in hindsight, would be the better way to do it. When you see an area pop up or starting to pop up, shut it down, you know, and that way you're not shutting down the entire economy from that standpoint. Very politically divisive here in the United States, how this was handled early on and continues to be handled presently. How are you doing from an ophthalmology standpoint? Are you back up to 100%?
We are, in terms of surgical cases, we are again at 100%. If we look at our outpatient clinics, we have about 15% less because of the space in the waiting area. So we have to keep the patients away 1.5 meters at least. And so it's too crowded if we would have 100% patients in our waiting areas. So I think that's the reason. It's not a medical reason. That's just so that we can keep everyone really apart from each other.
And surgically, you're able to do all of the elective cases, epiretinal membranes, and those sorts of things.
Exactly. We do all the elective cases. Again, during the general lockdown, the first weeks, we did only emergency cases, and we did the intravitreal injections. At least we offered. However, we realized that patients were afraid of coming to the hospital, and so we had about 25% less injections, not just because the patients had maybe some misinformation, or they were not sure whether they would be allowed to come or not.
That's interesting. Let's dive into that. What kind of misinformation did patients have that prevented them from coming in to get their eyes treated?
Well, when on TV you were told about this general lockdown, then patients, some of them called and said, well, I have this appointment, can I come, or shall I stay at home? We, of course, tried to reach all our patients by phone and either tell them to come if it's an urgent case, or stay at home if it was just an elective control visit maybe. So some patients could not be reached, and so there was a certain number of patients who were afraid to come.
And Patricio, you had a similar type occurrence where patients were afraid to come, but they actually were more afraid of the actual potential infection, COVID, through their eyes. Tell me about that.
Yeah, there was a big fear at the beginning that, you can catch it anywhere. They could just watch, TV shows, doctors on TV, sometimes giving the right message, but maybe misinterpreted, possibly. So many of them, they were like, I shouldn't go to the supermarket. I shouldn't go. Why would I go to the office? Touching my eyes could be a source of infection. So, they would not touch their faces and why go to a doctor that is going to be touching my eyes? How can I be sure that this is, clean enough and this is not going to be a point of entry for the virus? So yes, we and the patients suffered a little bit from the misinformation and also misinterpretation, because, sometimes you may try to pass on a message and, it is not understood exactly in the way that you would like to, to transmit it, and the patients take it maybe differently. It's nobody's fault, but it ends up causing these excessive fear, and they end up not coming to the clinic, unfortunately.
Yeah, there was a lot of information about the COVID-19 potentially being able to enter through the conjunctiva, through the ocular surface side of things. How did you dispel that with your patients? And is that notion still persisting, or is it pretty much gone at this point?
It persists a little bit, but what we try to do is, we show them how we keep things clean. So everything is going to be clean, but when they enter the office, we do the cleaning again in front of them. So they can see the patient seeing the doctor getting the alcohol in their hands, the equipment being cleaned by one of the assistants. They feel, we even clean the chair. So that's why the consultation takes maybe twice the time that it used to take. So we have to clean the chair, we have to clean the equipment, clean the OCT, all the devices that we use to check the eyes. So we make sure we do this in front of the patient. And that has been of a lot of reassurance for them. It's not the same if they tell you, this has never been opened, than if you actually wrap open the package yourself. So that gives a sense of, this is clean, and they feel more confident. When we finish the consultation, we clean again, so they clean their hands and we wash their hands so they can, feel totally reassured of the way we're working.
That's a great clinical pearl to do these things in front of the patient so that it demonstrates to them, hey, this is a clean area. And gives them that reassurance. Nicole, what sorts of things are you doing aside from the social distancing to help reassure your patients that their eyes are going to be safe as far as a port of entry for COVID?
Well, from our general hospital setting, we have to call every patient 4 days prior to the appointment and ask for COVID symptoms. And so during that call, they can also ask questions about what protection can you offer us as a patient? And so the first contact now is via the telephone, and then we have a restriction that people accompanying the patients have to stay outside the hospital. So it's not getting too crowded, and people see that every other seat is covered by a piece of paper telling don't sit here. So they really notice that distancing is something we really keep up. And yes, all these things that Patricio just mentioned, of course, gives the patient the confidence that everything's really clean here. We have shields at the slit lamp and also at the laser. So patients do notice that there have been changes, and of course disinfection is all over the place. But I must say that there are not only patients who are really afraid of COVID, but it's on the other hand, there are also a lot of patients who neglect the fear of the infection. And those patients, you really have to remind, please wear your mask and wear your mask again, and take care of this and that. So I think there are really both sides. Some are very much afraid, and some are just neglecting it.
And that leads me right into my next line of questioning, which here in the United States, it's a political election year and we have a very contested election. And there is a lot of doubt surrounding a variety of topics in regards to COVID, that the death rates aren't that high, that healthy people don't have to be worried, that masks aren't effective, that children don't get it or can't transmit it or don't get sick from it, which actually they may have lower rates of serious adverse events from it. What types of misinformation are you finding in Germany, Nicole, that just makes you wonder, where is this coming from?
Yeah, well, thank God this is only a minority of people, but we had 2 demonstrations in Berlin where crowds were on the streets and pretending that COVID doesn't really exist and that everything is just exaggerated, and especially people were annoyed by the schools that were closed, and that had a direct impact, of course, on the family, especially on the mothers who had to stay at home as well and cope with the children. So a lot of people are angry and want to ventilate this by telling, there is now such danger in COVID and everything's exaggerated. But this is only a minority. I think the majority in Germany is well informed by television, by the virologists. We do inform our patients. We get our information from the university virologist. And so I think the majority is well informed.
And Patricio, in Argentina, are you finding the same thing, that there are these conspiracy theories that put doubt as to whether COVID is harmful or masks work? And where are those coming from?
No, we're not getting that much of that. I mean, we're not getting, these people believing that the masks are some sort of a political thing that you have to wear or not. We did a lot better, and we are doing a lot better than neighboring countries. And, a lot of people get the information from the neighboring countries, like Brazil, for example. They had lots of cases. The same happened to Peru, Chile. It's a country that is just on the other side of the mountains from Argentina, and they did really poorly there. So everybody wears a mask here, and it's not a political issue. I mean, there's a division in the country as well because of other political issues, but masks are not one of them. There has been a demonstration of people saying that this is not a virus, but there were like 20 people. So it just comes to show that people take the message very clearly. The neighboring countries are a good example of what can happen if masks are not worn. But we went through several stages with us as doctors. At the very beginning, there were claps every night for those doctors were working, seeing patients through the pandemic situation. Then after that, that transformed into the bullying of doctors, because nobody wanted in your building. If there was a doctor, they would just, be cleaning the door on the outside, because this is the guy or the lady that is going to be bringing the virus into so clapping turned into bullying. Then the cases start sparking, and we could see cases everywhere. And now there's a bit of a sense of, people locked down for a while, and then they started opening a little bit, going out to the supermarket, buying things, resuming visits to the doctors. So there's no more bullying, there's no more clapping either. So we're, kind of normalizing the situation. But the mask wearing, it actually has become a trend. You can see people wearing all sorts of different masks, some of them very trendy, some of doubtable taste maybe. But one thing that we do for our patients is when they come, now that we don't have a shortage anymore, we give them a surgical mask, just a basic one. Because some of them, they may come with a very poor, handmade. So we give them one or maybe a few that they can take. There was a shortage way before, but not anymore. So we can share these with the patients, and they feel very, they appreciate this very much, that they can have a surgical mask. By no means this is any better than the mask that they may be wearing. Okay, it's enough what they wear. but they feel, they get the feeling that the doctor gave me this mask, and that's another act of caring for the health.
That's a great point. And that's such an affordable thing to do for our patients. I remember I had a patient come in about a month ago, and she had fashioned a cut up sock into a mask. And it was so sad to think that this patient had so little that she had to take a sock, and it was not a new sock, and fashion it into a mask. And so I found her one of our masks in clinic that we had and gave it to her. And you would have thought that was the most valuable gift she'd ever gotten. So it's very small things that can help our patients and go a very long way. Patricio, what is our role as retina specialists? We're not virologists, we're not epidemiologists, but we do come into contact with at-risk patients on a daily basis. What should our role be in talking to these patients about COVID-19 and the risks?
Well, basically what I discuss with the patients is that we don't know how long and how far this is going to go. So we don't know whether this pandemic is going to be around, this coronavirus is going to be around for maybe another 12 months, maybe. Cases are going to drop. Cases are going to come back, as Nicole just mentioned. It's happening in Europe. So that is going to happen. We know that diabetics are patients at very high risk, and we see lots of diabetic patients. But I think our role is explaining them that despite whatever other interpretation they may make of the information they receive, that we are going to be taking care of them in this way, so they are reassured that at least when they come to the clinic, this is not going to be a dangerous situation for them, okay? This is going to be a situation where everything is under control. If they wear a mask, we use full equipment, so we're fully geared to see the patient. That is really uncomfortable. You get it's difficult to use a slit lamp or any of the medical equipment that we need to use while wearing all this equipment. For the patients as well, they get they don't want to drop their mask, so it's difficult to go through a long procedure with that. So we reassure them that they need to take care of themselves. I put examples of patients that had COVID at my clinic, and some of them actually died because of COVID. And I tell them that don't think that if you are sort of very healthy, you're going to do better. And if you are a frail patient and of certain age, you're going to do worse, because actually we have examples quite the opposite. So, don't believe that because you're too strong or you believe you're too strong, you're going to do better and stop taking care of yourself. So we do reassuring, re-explaining of things. And I try to limit myself to the things that are directly linked to, what they need to do on the daily activities at home and when coming to the clinic. All the rest of the things, that would be too much to take. So I'm not going to be getting into other areas where they have different beliefs. So that is fine. Provided I make sure they understand the main things, I'm fine with that.
And Patricio, you mentioned that you are fully geared up. Are you wearing an N95 mask and a gown and a face shield?
Yes, that's the way I remove the face shield, explaining them, I will remove this face shield, I'll keep my mask because I need to, get into this device so I can look at your eyes. There's always the breathing, on the patient side, sometimes they breathe and the air comes up, everything gets foggy because of that. So it's difficult to just, a basic thing like looking with a lens inside the eye, just looking at the back of the eye, that may take a while. You have to hold your breathing, ask the patient to, bring the mask down a little bit so they don't breathe up and everything gets foggy. While you put this lens against the face of the patient, you can feel the breathing in your hands. So you have to wash your hands immediately after, clean the equipment immediately after. So it only takes more time. But if we are careful and we follow these steps, we will succeed in seeing all the patients with complicated cases, many of the others as well. And hopefully vaccines will be around soon and they will work and we will have less and less cases. And they will be just, this will be just something in the past for many of us, hopefully.
And Nicole, how are you handling the at-risk vulnerable patients? Let's say the patients who are nursing home patients who have COPD. Do you do anything different or above and beyond for those patients?
Well, we do a COVID test before we would admit those patients as inpatients on the ward, especially if they come from a nursing home. And other than this, of course, if it's a high-risk patient, we would isolate the patient in the room. But I feel that nowadays it's getting back to normal. Of course, everyone is wearing a mask. We as doctors are only wearing a surgical mask, so not an N95 mask. And of course, there is a lot of disinfection and keeping the instruments clean, but it's getting back to normal. It's rather that we now see the problems that this complete shutdown has caused, because we are now seeing, for example, retinal detachments that are not fresh detachments anymore. And then patients tell us that they had symptoms for a month or two, and they we're not seeing their ophthalmologist right away. Usually in Germany, if patients feel some symptoms, they see the doctor right away. And so they postpone the consultation. And now we have much more PVR cases than we had before.
And do you think that they postponed their appointments with those doctors because of fear of COVID, or was it because their doctors were shut down?
Both, but it's rather the fear of not getting too close to a hospital or a practice and getting too close to the medical staff. Yeah.
And is there a role for the retina specialist in trying to explain some of the misinformation about COVID-19 to these patients, or as Patricio alluded to, look, our job is just to ensure that these patients are safe, make sure they know the facts that they need to know about being safe from COVID. And then beyond that, it's mostly a political thing.
Yeah, well, we start with the patient, with every patient usually was shaking the hands. And so you tell everyone, okay, sorry, this is a Corona time. So, and then you are already into the discussion. And then it depends on what information the patient really wants to hear. And in the last weeks, it's rather that patients are very well informed and they just cope on their symptoms, and they just want to receive your advice due to the IDCs and not anymore to COVID infection. That is more a point if it comes to a surgery. So then patients will get some more information, and they need more information on how should they get a test or things like this. But the normal outpatient is back to normal right now.
And where do you get your information about COVID-19? Do you try to stay up to date? Is it news sources? Is it medical journals? Or is it your colleagues in medicine or in retina?
Well, we are at a university hospital setting here, so we have the Department of Virology, and we have on a regular basis, we have hospital conferences, and then we get the new information. So that's every 2 to 3 weeks that we get new information on what should we do, what kind of protection shall we use, and things like this. And of course, the TV is, is all over information on COVID, and of course also the journals.
And Patricio, same question to you. Where are you getting your information from? Do you follow and try to keep up daily, weekly? How does that look?
We try to get information from two different sources. One is having an idea of what's going on worldwide. So, what's going on, what is being done. So maybe we can pick up some ideas from there. That would be from different journals or websites that offer a trustable source of information. The CDC from the US is something that we look at, which is very good for providing good information for doctors and for patients as well. It comes in several languages, so patients can access that as well. For local information, we do a kind of, it used to be a weekly meeting. Now we do it every 15 days. Every 2 weeks, we get a meeting with a local specialist that will be releasing information of what is being done, what's happening at the local biggest hospital, the amount of cases, the amount of beds available. And we try to release some of this information to the patients, not only talking to them, but also giving them a little leaflet, so the patients can take with them a bit of information that they can read, that is updated, what to fear, what not to fear, what should you do with these and that. And little by little, we are educating our patients and giving them the best information available. And we're doing a better job in transmitting these to the patients. So local information from local sources and international information, we are months behind what happened in the US and Europe, so we can learn from them, to try to avoid some mistakes that were not just mistakes, but lack of experience, because it is a new virus, right?
And it sounds like you've done an outstanding job of actually learning from others' mistakes, ours, Europe's, and even in regional countries in South America that had worse cases. What's the status of a vaccine in Argentina?
We have several trials of the main vaccines happening here. Because of the high numbers of cases in the city, it's a good ground to test the vaccine. Many of the doctors are participating. Most of the time, we try to include patients in clinical trials. Now we end up being part of a clinical trial as patients because we are highly exposed. So we will be, a good population. So many of the doctors are taking part in these clinical trials. Getting the sort of either vaccine or the placebo, and we will see over time what happens. But many of the big vaccines, from Pfizer, the Chinese one, the one from Astra, Oxford, all those 3 vaccines are being tested here within the city.
That's fantastic. Nicole, same question for you. What's the status in Germany of vaccine testing?
Yeah, well, there are trials going on, but I think the general opinion is that it will last until next autumn, until we would really have a vaccine for, the whole population.
And you led right into my next question, and my last question, actually. Here in the Northern Hemisphere, we're starting to head into winter. Nicole, in Germany, how do you think this is going to play out over the next 6 months?
Yeah, so we have already experienced, also due to vacation and due to less restrictions, that the numbers are increasing again. And I think in Europe, we are expecting a second wave. And now, since all these outside areas are closed and it's getting colder, and people will face more restrictions again. So there is a big discussion on whether the restaurants can now cope with the situation, or shall there be heated outside areas so that people can be separated still. So yes, it's getting autumn, it's getting winter, and we will face more problems with that.
And Patricio, the same question, but kind of in a different light. You're getting ready to head into summer now, where we had hopes in the spring that it would curtail the virus. Unfortunately, here in the United States, it really kind of took off. Much of that related to July 4th and vacations and group gatherings and lifting of restrictions. How do you see this playing out in Argentina and in South America as we head into the warmer months?
Well, what you described, John, happened also in Europe with, the numbers going down, people going to, the beaches, going around, traveling all around Europe. And then you can see Italy, you can see Spain and France picking up again, even the UK, picking back to the same amount of cases that used to have at the peak of the season. So I'm sure we're going to be learning from that experience. We're going to be dropping the numbers, but by the time we hit the summer, which will be like December, January, there's going to be a lot more staycation rather than vacation. So hopefully people will stay, not make these mistakes that were done in Europe. We can learn from those, and we will probably try to go through the summer in a better way, hopefully getting nearer to the time of a vaccine available, hopefully.
You know, you're absolutely right. And I think we can learn from some of our brethren in the Southern Hemispheres. You look at New Zealand and Australia and certainly Argentina, you weathered winter already in the midst of this and actually came out fairly unscathed. So I want to thank both Patricio and Nicole for joining me today. It's been a fantastic discussion about how we deal with the misconceptions surrounding COVID-19 and a variety of other things. And I want to thank our listeners for joining in on this episode 5 of New Retina Radio Back to Practice. Join us in the next couple of weeks as we have our next episode. Patricio, Nicole, thank you and stay safe.
Back to Practice has been made possible with support from Allergan and Novartis. We'd like to thank our sponsors for their support of this programming. This webcast podcast is intended solely for ophthalmic healthcare professionals and ophthalmic industry representatives. By accessing this webcast podcast, I acknowledge that Bryn Mawr Communications LLC, herein BMC, along with any all third-party corporate supporters of this webcast podcast, makes no warranty, guarantee, or representation as to the accuracy or sufficiency of the information presented in this webcast podcast. BMC, along with any all third-party corporate supporters of this webcast podcast, do not endorse, approve, recommend, or certify any of the opinions or information presented or mentioned. BMC expressly disclaims any and all liability or responsibility for any direct, indirect, incidental, special, consequential, or other damages arising out of any individual's use of, reference to, reliance on in this webcast podcast.